From Washington, D.C. to your computer, this is Sounbytes with Sam Farr, a timely look at issues of the day. And now, Congressman Sam Farr.
Welcome to another episode of Sounbytes with Sam Farr. Congressman Farr, one of the issues that you have talked about a lot in the realm of health care and health insurance reform is GPCI, the Geographic Practice Cost Index, and the problem that it gives to doctors on the Central Coast in undercompensating them compared to close regions. Was this in the final health care bill, and what happened?
Well, this issue called GPCI, the Geographic Practice Cost Index, big complicated word, essentially means the Medicare reimbursements, the payments that doctors receive. And the way the plan works in America is that those payments, as in other things that government pays for, are based on economic indicators in an area. For example, New York City is a little bit more expensive to live in than Pocatello, Idaho. So the payments for people working in government in New York are higher than the salaries. They get what they call locality pay. And the same thing works out with doctors that are in different regions. Unfortunately, the economic data can sometimes be wrong because it's old and hasn't been updated, and that's the case in our area. And so we have 8 or 9 counties in California, including Santa Cruz, Monterey, and San Benito counties that I represent, whose doctors receive the lowest payment in the nation for Medicare service, while the doctors in Santa Clara County and San Mateo County, the counties surrounding us, and Southern California, the Los Angeles Basin, San Francisco Basin, receive the highest. So look at it in San Benito and Santa Clara, where the county right next door, and people don't even know where the county boundaries are, but the doctors in those counties receive the highest reimbursements for seeing Medicare patients, and the doctors in San Benito and Santa Cruz County receive the lowest. It's not fair. What's happening is the doctors say, I can't afford this anymore, so I'm not going to see you. Now, these are elderly people who have insurance, Medicare, but can't get a doctor. And what do when they wait, which is dangerous when you're old, and they wait until they really need some help, and they go to the emergency room. Very expensive way to deliver medicine. So what we're saying is, look, we got to fix this, and we got to fix it on merit. Studies show that these 8 counties, not all the counties in California, but these 8 counties warrant an upgrade in payments. And we had it in the House bill. It was not controversial. We had it in the negotiations with the Senate. It wasn't in their bill, but they agreed that if we were going to do a conference report, essentially the differences between the House and the Senate versions, that this would be in it. Along came some of these issues that were very controversial in the health bill, including what they call the Nebraska, the Cornhusker fix, and they had other ones that essentially were commitments that senators had gotten to put in sweetheart deals for their own states. President Obama said, we got to get all these out. This isn't fair. People are really upset about this, and rightfully so. So when they stripped the bill of these sort of single state fixes, here was California, not controversial, I have to say, because we were based on merit and by studies, economic studies that showed that it was this had to be done. But just in all fairness, to not have us be Californians singled out, they took it out. And so it was unfair to us because we'd done our homework, we did it right, we did it by the merit, but the politics, it's politics. And it's particularly because the Speaker's negotiating the bill, and it was a fix for her state. We're going to get it done. We're just not going to do it in this bill.